Welcome, everyone. Thank you for joining us today. My name is Dr. Louise Ivers. I'm the director of the Harvard Global Health Institute. I'm delighted to welcome you to HGHI's series called Coffee Sessions. This series is designed to explore and discuss the role of partnership and collaboration when working to advance global health equity. We welcome you to mark your calendars to join us on the last Friday of every month in the future for future sessions. Today, I'm delighted to be joined by Drs. Franke and Renato Errea, who will be presenting on leveraging partnerships to improve the health of young people living with HIV in Peru. This session is being recorded, and the recording will be made available on the HGHI YouTube page in the coming days. We will have time at the end of the presentation to answer questions from attendees. If you have a question, you can submit it through the Q&A feature on the bottom of your screen. We're going to try to answer those during that session of today's event. So with that, please allow me to introduce our speakers today. Dr. Renato Errea is a Peruvian physician researcher with nearly a decade of experience conducting global health research and interventions focused on people affected by HIV and other vulnerable populations in Peru. Dr. Errea is the head of the HIV program at the Peruvian NGO Socios En Salud, where he leads interventions and studies focused on facilitating access to comprehensive care to the communities most affected by HIV and other prioritized populations in the context of HIV, including adolescents and migrants. Dr. Franke is an epidemiologist and associate professor in global health and social medicine at Harvard Medical School. For nearly 20 years, she has collaborated with Socios En Salud on research to improve the health of children and adolescents affected by TB and HIV. Her current intervention work includes studies to reduce stigma and improve the well-being of adolescents and young adults living with HIV through the provision of community-based accompaniment and youth-friendly modalities such as music videos and social media. With that, it's my honor to turn it over to Drs. Franke and Errea. Thank you.
Thank you very much, Dr. Ivers, for the invitation to be here today. Good morning, everyone. Thanks so much for joining. Before we launch into a description of some of the work we're doing within our partnership, we thought that we would maybe expand on that introduction to provide a little bit of background about ourselves and also our relationship with both Socios En Salud and with Harvard as well. So as Louise mentioned, my primary training is in epidemiology, biostatistics, and infectious disease. And I first began working with Partners in Health in Peru, also known as Socios En Salud, in 2003, really right out of undergrad as a volunteer. And it was there that I came to learn about the Socios En Salud and Partners in Health approach to providing care, and just became very much in awe of sort of the critically important and life-saving work that they were doing there under really challenging circumstances. And it was really that experience that led me after about a year and a half to seek out training in epidemiology at Harvard, really with my sights set on developing a skill set that I could contribute to the Socios mission of addressing health equity through service, research, and advocacy. And upon finishing my PhD, I came on at Harvard as faculty, and it was in that role that I came to know Renato.
Thank you, Molly, and good morning, everyone. Thank you for having me here. Well, yeah, I am, as Dr. Ivers says, I am a medical doctor from Peru. I finished medicine here, and then after 3 years of conducting HIV research through an HIV research training grant, I applied to this master's in global health delivery in Harvard Medical School. That was back in 2017, I think. Then I finished my master's in 2020. I came back to Peru. I was working on another NGO different than where I am now. But then after 1 year, I contacted to the director of Socios En Salud. Just asking for a job. We knew each other before because of the masters. This master have a lot of connections with the with partners in health globally, including Peru. That's how I entered the NGO here. And after being in some roles, I ended up at the end being the head of the HIV program, where we are conducting, Molly and I are conducting this research on HIV and youth.
Great. So with that, maybe we can move into sharing some of our work together. So Renato is going to talk about our first project together, which is nicknamed Paseo.
Yes. So we have two projects going on now. This first is a randomized clinical trial. It is a community-based accompaniment intervention to support youth living with HIV while they transition and enter to adult HIV care here in Lima, Peru. So it has two arms. We have a sample of 160 participants. We are very happy because last week we just reached half of our samples. We are very happy for that. This study is being conducted in 10 healthcare facilities in Lima. Lima is the capital of Peru. And this study has several components. So what we do is here highlighted in these color boxes. So the components that we provide to our participants are all the 7, and they are comprised of first health system navigation, then mental health screening and referral to the Ministry of Health services. We also conduct monthly check-ins with health promoters. We try to solve some acute needs related to, for example, housing, food, among others. We provide individualized support for antiretroviral adherence. We also conduct something that we call peer support groups, which is something very interesting because this is a space where they can feel safe and freely to talk about their emotions and how they feel about living with HIV at that age. And finally, we also provide education sessions, which include clinical content that sometimes in the routine clinical care they cannot get, and we also provide some content about that may help them for their lives. For example, some support on how to get a job, on how to plan or how to establish a short or long-term development plan. This is some ways on how we measure the study outcomes. So besides measuring the clinical and some psychosocial outcomes, something that is very interesting here is that, well, of course, we also measure the implementation outcomes to see what worked and what didn't work. And also, something that I consider very important is that we are including costing analysis. I think this is very useful because some of the things that we try to use or that we try to do here at CES is here at Socios in the NGO is we try to scale up all of our interventions to the routine care in the public healthcare system. So this costing analysis is very useful if we want to then reach the Ministry of Health to see how much it will cost to implement this in the routine HIV care. And at the end, we also have some focus groups and interviews with the participants and also with the implementers to see, so, as I said, what worked and what didn't work and what could be improved for next studies or projects. This is our team. This is a big team. So this is our team from Peru, our team from Harvard, and then we also have some partners. All the doctors working in hospitals, which are the sites of our study. And then we also have all other sites, which are primary care centers. So among the 10 sites, we have sites which are hospitals and other sites which are primary care centers. These sites have been very useful because in Peru, HIV care is being decentralized little by little. So a lot of new participants from our studies actually come from these other primary care sites. All of our works are being conducted with the Ministry of Health, MINSA, as we call it here in Spanish, and the direction of HIV program knows about it, and they are also waiting for our results. And something very interesting here is that we have a partnership also with what we call our youth advisory board, which is a group of youth living with HIV, ages between 17 and 28, which provide constant feedback to us, and they also approve some of the content that we deliver in our projects.
Great, thanks, Renato. And one thing that I'll just kind of flag here is that, as Renato mentioned, our relationships with particularly the collaborating health centers have been really, I think, critical, because that's where the majority of young people are receiving their HIV care. And our ability, I think, to collaborate very effectively with these health centers is in large part due to the long-standing relationship that Socios, and particularly Renato's team within the HIV program, has in supporting efforts to decentralize care in the country. And so I think it was those established relationships that really made this work possible. And I think the other thing that strikes me is that this work, all of our work with adolescents, really sort of arose from a long-standing partnership that Socios En Salud had with the National Children's Hospital. So Dr. Lenka Kolovic, who you see in sort of the left-hand corner of the green box, is just an incredible pediatrician who's been treating HIV in Peru since the early 2000s. And it was in the context of another project with her that she really came to Socios asking for support in addressing the needs of this population that she felt were very unmet at the time. So all of this work is really due in large part to her advocacy and also Socios's long-term relationship with her. I'll now talk a little bit about the second project that we're doing together, which is in a community-engaged social media campaign to reduce HIV-related stigma. And so there are 3 phases of this work. For us, the community engagement piece was very important. So our first phase was really to listen. So we conducted a number of focus groups and individual interviews with key stakeholders, many different groups of young people living with HIV in Peru, from those with recently diagnosed HIV infection to those that had been living with HIV since birth, individuals that engage in sexual transactional sex or sex work, sexual and gender minorities, HIV advocates. And really what we wanted to learn from them is what they wanted to see change as the result of a social media campaign, and what did they feel like were the key messages. And so we completed that phase last fall, and right now we're in a second phase, which is preparation. So we are in the process of developing social media content on the base informed by phase 1 and also in recruiting influencers. So a big part of this grant is it's really a feasibility grant in the end, and we're hoping to learn how we can effectively work with influencers to engage them in messaging. And then the third phase, we're about to enter the third phase in early July. So we'll be starting a social media campaign, I think around July 1 of this year, which will take place on Instagram and TikTok. And that campaign will last for 3 months. And we have a couple of evaluation phases as a result of the campaign. So we'll look at engagement with the pages and with the different content. But we'll also be looking at the impact of stigma on a small cohort of individuals that are living with HIV. And then we'll also look at the effectiveness of the content in changing ideas around HIV. And at the end, we'll conduct some focus groups. And again, we have, as with Paseo, I think we have a very multidisciplinary team here that includes experts in a lot of different areas, from marketing and communications to community engagement to clinical to qualitative. We also have been collaborating with Kristen Kasilik at the University of South Florida, who brings really critical expertise in stigma that we did not have within our team. And I think one of the interesting pieces about this is, we've been collaborating with 2 different agencies. One, a content creation agency that's been helping to develop our content, and then a agency that's focused on helping us engage with influencers. And so figuring out how to make sure, for example, that the content creation agency really understands stigma and understands the messages so that they're able to translate that information into content that will be well received by a young audience has been one of, I think, the big challenges that fun challenges of this project. And then all of our content is sort of reviewed on an ongoing basis with an advisory committee of young people living with HIV, as well as HIV activists. So I think that's sort of an overview of the projects that we're working on together. Renato, one thing that occurs to me is that, I think the nature of our professional relationship has really evolved over the years, because we first met when you were a student in the master's program at Harvard Medical School. And I was actually your faculty advisor at the time. And over the years, I think our relationship has really turned from one of mentor-mentee to colleagues. And I'm just wondering if you could talk a little bit about what that transition was like for you. Was that something that, were there certain things that you see that made it easier or things that made it challenging?
Yes, for sure. So I would say there have been some facilitators for this to happen. So first, I did have some experience working on HIV before coming to the master's. So I think that that was very helpful in feeling comfortable doing HIV research. So once I entered the master's, as you said, well, you were my mentor. My thesis didn't have anything to do with HIV. It was actually about breast cancer. But during my master's, I did support you with the pilot study of the first study that I presented. So I continued, I would say, my training in HIV research thanks to this work that I supported to your project. And then after the master's, and I think being in the master's, being your mentee, and also working in the project helped a lot to get to know each other and to get to know also how Socios En Salud was, because this pilot was also implemented in Socios En Salud. So after finishing the master's, I already knew you. We already know how we both worked, and I already knew Socios and Salud. So I think those two were pillars to then me being accepted or being hired in Socios and Salud, and we think we took advantage of those of that background. And then I would say naturally we realized that there were a lot of opportunities to work together. And something that I really appreciate and that I'm thankful is the confidence the confidence that you have on me, and that you trust me on my skills to continue doing research, and not only as a co-investigator, but also you provide me with the opportunity to lead locally some of the projects. So I would say the transition was facilitated but several things, including the support that you provided me during this time. And it was difficult in terms of it was faster than I probably thought. But things went smoothly, and I think it felt as the natural path. Something that was difficult, and I think we can also talk about this later, is that as the head of the HIV program here at Socios, I am not only in charge of conducting this research, but I am also in charge of administrative staff, of HIV programming, of maintaining the connection with the Ministry of Health, and all other responsibilities that I have here. So it was difficult in terms of I would have liked to. Sometimes it is difficult to just dedicate all the time that I would like to do to the research itself. But overall, it has been a very interesting and enjoyable path.
Yeah, I mean, I think the point that you raised about kind of the nature of like the academic NGO partnership is super interesting. And that's a challenge that I think that's probably one of the #1 challenges that I think about, is just, I mean, just so folks who may not know are aware, I mean, I think one of the amazing things about Socios is there are no kind of people who are just researchers at Socios. So everyone that participates in research is also very much embedded in programming and clinical care, and that's very much by design. And I think it's a huge strength in a lot of ways, because it ensures that the research never strays too far from kind of institutional priorities. But by the same token, I think you know, I think it's difficult to prioritize research when it's always happening in the context of clinical care. And it's something that I'm mindful of, because on one hand, when opportunities arise, I sometimes wonder is kind of what if you know, for if there's an opportunity to give a talk, that's always, it's either adding something else to your plate or potentially competing with kind of other priorities. So I do think that's a challenge. Like, I'm curious, I guess I can think of a couple of examples where I think you've been incredibly effective at kind of leveraging these partnerships to kind of generate new avenues and collaborations, like for yourself as an independent investigator. Do you maybe want to talk a little bit about those?
Yes, two examples come up to my mind. So there is one, Molly mentioned me. She shared me about this opportunity to apply for a grant provided by Harvard Center for AIDS Research, and we talked about the opportunity for me to apply as a PI, and Molly being my mentor. This was a grant focused on monkeypox and HIV. So we thought it was a good opportunity for me to apply as my first fully PI role, I would say, because here in the studies that we mentioned today, I am the PI, but I'm the local PI and only being the overall PI. But this study was different. I am the PI of this study. It is a small grant compared to others, but it is a very good way to start being a PI and to assume new challenges. So I think the study is almost finished, and I think it has gone well with the support of Molly. And then the other example that comes up to my mind is so we are in the second study that Molly presented, the DMS study. We partner also with the University of South Florida, and the co-investigator there is Christine Kosiluk. She's an expert in stigma. So we are actually the three of us who are kind of guiding this study. So another an opportunity to apply to an NIH grant came, and we talked about it, and we decided that it could be a good idea if Christine and I apply as multiple PIs. So it's very interesting how partnerships already established can also bring new partnerships, probably with the same people involved, but assuming different roles. And this is actually what happened here. So we applied to this grant, we got a good score, and we are planning to apply for a next round of this grant.
That's great.
And then Molly, I also have some questions for you. So working in Peru might be different from working in the US. So I was wondering if what are the challenges for you as an international investigator to work or to do research here in Peru?
Yeah, it's a great question. I mean, I think we touched on one of the big challenges of just kind of navigating the different environments, sort of a more kind of a stricter research environment at Harvard versus a care delivery environment at Socios. But I think for me, actually, probably the number one kind of both facilitator and challenge is sort of establishing trust with new teams. So, you know, for some projects, I work with team members who I've known for 20 years. And I think those are very easy to navigate. But I think, you know, with Paseo, the first project that you presented, that was other than you, that was a nearly entirely new team for me. And so I think kind of trying to build those relationships from afar at times that are very busy, you know, at the beginning of a project where there's a flurry of activity to kind of get everything approved and moving, I think can be really challenging. And I think it takes a long time to build trust with new team members. And I think having you as a liaison helps. I think having that in-person time is really critical. Social activities such as, we've had a few team retreats with dancing, and I think opportunities to sort of allow everyone to kind of let loose and maybe embarrass themselves helps, as well as honestly kind of supporting each other through mistakes. So, I think that's oftentimes the trepidation with new relationships is there's kind of a fear of making a mistake, but then we know that it happens. And so I think, when things do go wrong and seeing that we can kind of address them and solve them as a team, I think that also goes a long way to building trust. And then I think the other obvious one is just communication, because communications are so important in partnerships. And while I feel like my Spanish is, relatively strong, I do spend a lot of time kind of editing emails and thinking about how I word things, just because I don't have the same level of Spanish fluency that I do in English. And so I wonder, is this coming off with in the way that I want it to? I think the few instances where we've had someone who's truly bilingual on our team, it's been just a huge help, because it's sort of going back to the trust thing. I think it allows you to kind of build trust almost immediately. Can you think of other challenges? I mean, I'm sure that there are challenges for you working with international investigators as well that I didn't mention. Can you think of, like, for you, what are the other big challenges?
Yeah. So I would say it's related to what you said. Probably one of the big challenges is um, if you are if you as an international investigator are gonna start working with a new group, for me a big challenge was just choosing the right project coordinator here in Peru. Something that was someone that is actually uh, someone that I trust and that I think would do the work well, so you can also trust her. Well, in this case it's her. And I think that was very important. And also acknowledging the I mean, we knew each other, so probably there was no adaptation time needed. But for her, probably it was important to just acknowledge that might take for her some time to adapt to just the work style, not only of you and your team, but in general the work style of something of the work style of someone from abroad, and especially probably Harvard, because Harvard is very strict, and that's very good actually. Um, so I would say that is very key. Just choosing the right coordinator that I think will match with both I and you, me and you, and then some other things that are very necessary, as you said, as is having weekly meetings. So the frequency of these meetings are very important. Just having meetings every other week is not enough. Having weekly meetings is very necessary, and also the in-person visits that you mentioned. I think you have come, you and your team have come here this year more than 3 or 4 times, which is, I think, great. And then in these meetings, probably just having a good way to summarize the advances and the progress reports is something critical for me to be sure that the work is being done great, and also for you because you are not here in Peru and you also want to see how things are going on. So just that, like, having a good way to present progress reports is something very, very, very key.
Yeah, I agree. Before we hand it back to Dr. Ivers and open it up for questions, I was wondering if you want to comment at all about sort of the challenges of maybe partnerships generally, but also particular difficult moments or conflicts that we've had within our partnership, and sort of what has kind of helped to navigate those difficult moments, and sort of strategies that we found to be effective.
Yeah, for sure. So I think we haven't had too many actually, and the few that we have had are probably more related to not being specific, not being completely clear about the roles and responsibilities of some of our team members, and something that I appreciate and admire a lot about our partnership and our relationship is that we haven't shied away from having difficult conversations when it was necessary to have them, and we have also in the few occasions when there has been some when the temperature of the conversation has risen probably higher than we would like, we have been able to talk about it and to just solve them and pass it like quickly. I think that's something very, very, very important, and that have been built along all these years that we have been working together. And just
Yeah.
probably to finish, Molly, I wonder how do you see our partnership going on, or what are your expectations?
Oh, that's such a good question. I mean, I feel that my partnerships with Socios and with you specifically are, just kind of one of the greatest professional joys that I have. I think it's such a gift to be able to have people that you like to work with and that you feel like have shared ideals. And you know, I think in doing this work together, it's just reinforced that I think addressing HIV among youth in Peru is so critically important that I'd love to continue this work together. I would love, you know, our next grant to be one that is PI'd by you with me in a supporting role. And I think I could totally see that happening in our future work. What are you thinking about in terms of what you'd like to do next?
Yeah, probably. I mean, that too, definitely. But I was just thinking more in the short term, probably. You know, there is not actually much research on HIV on youth here. So I think we are one of the few groups who are conducting this type of research and touching and or addressing this topic here in the country. So I would really like to build this cadre of health professionals who are experts in HIV in youth, not only in the NGO, but also probably then expanding it to other places, in general, to expanding it to the Ministry of Health. So I think that's one of my personal goals here, to build this cadre of professionals who are experts in HIV among youth.
Yeah, I think that would be great. Dr. Ivers.
Wow, thank you both so much. I've so much enjoyed being a bystander and watching you have this conversation about the relationship and the partnership, as well as hearing more details about the work. And I think there are a lot of things we could ask you about. I'm curious a bit if you could tell me about how the ideas bubble forward. Sometimes I know in global health partnerships, the kind of divide between where the resources are and where the ideas are and what ideas can be funded in research or are fundable, and the stresses of service and science intersect. And you mentioned in particular in your youth advisory board. I'm curious, and maybe Renato, you can answer this first. I'm curious about, as you think about the ideas that are important to you and the research questions you have, or maybe you both as your youth advisory board come up with ideas, how do you navigate what is of interest there? And then maybe where their science funding and research funding is coming from, and what the priorities are of funders and donors. Does that question resonate? I'd love to hear your thoughts on that.
Yeah. Thank you for that question. So actually, our youth advisory board is very interesting because I consider it both as a product of our partnership, because it was built while we were conducting this pilot study of the Paseo study. And it is also now a new partnership with that. So we have this partnership with Social Harvard and the Youth Advisory Board. And they have been very, 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 very helpful, not necessarily, I would say, providing us with new ideas on what to do research on, but definitely they have been very, very, very helpful in providing feedback on if the ideas that we had were actually meeting their needs. And that's something that's the whole point of this advisory board, to know actually if we would contribute somehow to address any of the needs that they have. So of course, we have presented them all of our applications to them, and they have provided us with great feedback to change or to adjust some of the methods of the studies. And even the studies that we have applied and we have not get the funds yet. But probably also Molly knows more about it because she was the official founder of this advisory board, so probably she can also give some more comments about this.
Yeah, it's an interesting question. I mean, I think in terms of funding, it's really true. I think the point that you make, I mean, are like this idea of addressing youth that are transitioning to adult care. You know, to be perfectly frank, we applied for that. That was a specific research priority for the National Institutes of Health. But we also saw that it was a need in Peru. And so, but we concentrated on that area specifically because we knew that it was an area to which we could get for which we could get funding. But I think, you know, it was a need. And so I do feel like that happens sometimes. And I think like with regard to the Youth Advisory Board, it was very interesting because initially we did not want the Paseo study to be a randomized trial. And we tried several times to submit that project using historical controls. And we repeatedly got comments from our colleagues at NIH peer reviewers saying they wanted to see a trial. And we took this conundrum back to the Youth Advisory Board and had what was just, I was amazed by, it was just a very sophisticated conversation in which we reviewed different study designs, the pros and cons in terms of both the participant experience, but also sort of the rigor of the data that would be generated. And that's sort of how we landed on our current study design, which includes elements, it includes a very strong element of mental health support for the control participants, as well as the opportunity to cross over for individuals that have an unfavorable outcome. And that was very much a decision that was made in collaboration with our Youth Advisory Board, trying to navigate just exactly that tension that you mentioned.
Yeah, thanks. We're almost out of time, but I do want to squeeze in one more question if I can, and it's kind of combining a comment and a question that we got. So if I'm understanding correctly, Renato, you came to Cambridge, to Boston, to Harvard Medical School, and that's where you two met first. Did I get that right? So I'd love to, can you comment a bit more on this, maybe this master's program, because I think that's very interesting. Like sometimes we see global health partnerships where, you know, the US faculty person goes to the country and finds a researcher to work with. So I love that actually you were doing some advanced training in Boston and met with Molly. Can you comment on this Harvard Medical School relationship, the master's program, maybe the opportunity, or maybe even tell us, Renato, how did you hear about this program? Maybe that's a more direct question. How did you hear about the program? And it sounds like it's been very impactful in your connections and your work, and even now at Socios.
Yeah, of course. So when I finished studying medicine here in Peru, I entered this NIH research training grant for 2 or 3 years, I think. And then I think that's when I just got in love with global health. So one of my mentors, I talked about this to my mentor by then, and she has heard of these and other programs. I then Googled more about this program, and I thought this was the program that better matched my needs or my career goals. So the Master of Science in Global Health Delivery provided by Harvard Medical School, I think is very unique in terms of it forms you not only in research but also in implementation, which were my professional goals by then and also now, and are also the goals or the vision of the NGO where I work now. So, but then I think just when I was there, because I didn't know Molly before entering into these masters, but I do think all the things align because Molly was conducting research in Peru in HIV before I was also conducting research. We were both interested in global health. Molly was my mentor for my thesis. And then I would say all the things just align us for us to continue working together in HIV. And of course, I would say the very good mentoring that Molly provided to me was also key to this. I am thankful with the mentoring that Molly gave me during the program, and that she is also providing me now with the grants where I am working with her, and the grants where I am trying to apply as PI, and Molly as my mentor.
Well, that's lovely. Molly, any last word before we close the session?
No, I'll just reiterate. I really enjoy our collaboration, Renato, and I'm grateful for it on a daily basis.
Thank you both so much. We're really grateful to both of you. This has been absolutely fantastic, and we appreciate you having this conversation in public so we can all learn from your work and your relationship and your partnership and how you navigate it. Thank you so much. I want to thank all of our attendees today for joining us. You'll find the recording on our YouTube channel in a few days, and please join us next month at the same time, same place, at the last Friday of the month. Thanks, everybody.